podcast with your host, Sana. Now, in this episode, we have a deeply personal and inspiring conversation stored for all of you with Dr. Brett Coates, a recently retired ENT physician and surgeon whose life took a dramatic turn when his secret battle with opiate addiction became public. Through humility, perseverance, and recovery, he was able to reclaim his career, and now he dedicates himself to coaching other physicians who are struggling with burnout and substance abuse. And in this episode of The Mindful Living, we'll get to know about Dr. Code's journey from addiction to redemption, the lessons learned along the way, and his new mission to support fellow doctors facing similar challenges. So, whether you are in the medical field or you know someone who is in the medical field who is struggling with this, or simply seeking wisdom on resilience and transformation in your personal and professional life, I believe this conversation is definitely for you. So, let's get quickly started. So, Dr. Brett, welcome to the show, and it's an absolute honor having you with us.
Well, thank you so much for having me. I'm looking forward to it.
Of course, of course. So, Dr. Brett, before we talk about um, the current scenario, or what are the insights on the topic, so I think our listeners would love to know about your journey because it's both heartbreaking as well as inspiring. So, can you take us back to the early days of your career? When did you first recognize the signs of burnout and substance abuse?
Sure, and I'll start even further back than that. So I was born and raised in Louisiana in the United States. Louisiana is in the southeastern portion of the U.S. And uh, by the time I was 8 or 10 years old, um, I grew up in somewhat of an academic household, and it was somewhat intimidating because my father was a professor of mathematics at the local university. Um, my mother was a professor of English at the same university, and my sister was in law school. So I was, from a very early age, I knew that it was expected, that I go on and do something academically related.
Right.
Um, but I didn't really feel any pressure per se. My parents didn't say you're going to be this or you're going to be that. Um, but my mom did mention more than once when I was a child that she thought I would be a good doctor. Um, so fast forward to now I'm in college at the same university that my parents are teaching at. And I become sick with cancer of the lymph nodes, lymphoma. And up until this point, I did not know what I was going to do. In fact, I was majoring in history simply because that's what I enjoyed the most. But after a year and a half of treatment for cancer, I decided that yes, I want to go to medical school and I want to be a doctor so that I can be in the same position that my doctors were in and kind of pay it forward, so to speak. So it was really my battle with cancer as a teenager that inspired me to go on to medical school. And it was also the first time that I was exposed to opiates, um, which is what most people know as pain medication. Um, I took pain medication during my cancer uh, battle for several different reasons, but I did like the way that they made me feel, although I did not have any issues with abuse of it during my cancer battle.
Mhm.
So I go to medical school. I do very well in medical school. I match in a residency program in Houston, Texas, which is inside the Texas Medical Center. So I trained at Baylor in Houston in general surgery for 1 year and then ENT surgery for another 4 years. So by the time I'm out and I'm starting work, it's about 2009 and I am 32 years old. My wife and I are also starting a family at this time. Both of my children are adopted because of treatment for cancer. It I was sterile after that because of all the chemotherapy and the stem cell transplant. So my wife and I were blessed with two adopted children. But I mention that because several things are starting for the first time. I'm working on my own as an actual doctor and surgeon for the first time. We're parents for the first time. We're in a new city. So there are lots of firsts and there are lots of balls in the air, so to speak. Um, but this is a position that I had dreamed about for at least 13 or 14 years. I was finally here. All of the studying, all of the training, all of the early mornings and all of the late nights and the sacrifices that I'd made for my family and that my wife has made for our family as well. All, you know, went into building this career that I'm starting. So I have everything that I've really ever wanted. And on top of that, I'm in the Texas Medical Center, which is, one of the hubs of the medical community throughout the entire world, really. So, everything went great. I built my career over a period of about 3 years, and, I was highly successful. I was enjoying myself. Everything was going well. And after about 5 years, I started to get a little bit anxious, and this was a feeling that was really foreign to me. I had never felt this feeling before. But if I had to describe it, I would say that what I was feeling was boredom, essentially, or a lack of fulfillment. Um, I had been climbing this mountain. I've been fighting and sacrificing and working and climbing this mountain for so long, and I had finally reached the top of this mountain, and I'm looking around and and I'm thinking to myself, okay, well, what's next? What's the next challenge? Um, and that was a mistake on my part in perspective because a career there really isn't a beginning and a middle and an end uh, to a career, much like life. It's for me at least, it wasn't the best way to think about it, as having a beginning, middle, and end, because once you get to the end, what's the next challenge? That's the problem I was facing. And so to relieve this boredom and to relieve this kind of lack of fulfillment, um, just one Friday afternoon, I decided that I would take some leftover pain medication from a previous surgery. I remembered the way it made me feel way back when I was a teenager. Um, and that one decision to take that pain medication that one Friday afternoon um, ultimately led to a 5 year um, addiction and abuse of opiates, pain medication, um, that, eventually led me to losing my job and having to go to a rehab facility for 3 months. So that's the background and the story up until when I finally sought treatment for the disease of addiction.
I mean, it requires a great, insurmountable amount of courage, vulnerability, clarity, um, and resilience to share your journey with highs and lows as well. So, first of all, thank you so much, Dr. Brett, for sharing your story because I am really, really confident that this will serve, or rather, in fact, it is serving as an inspiration for not only doctors or people in the medical field, but I guess for everyone out there who may or may not be struggling. And uh, when you mentioned about the initial uh, first half of your story, what I thought, that there is kind of a pressure to be perfect. When you mentioned that, everything was there. You have, house, you have your career, you have your family, you have your kids. And I think a lot of people, not just doctors, they can relate to that. I can relate to that. So, did you feel like you had to wear a mask at work, just pretending everything was okay, or I I mean, or was it something else?
Um, well, first of all, you're absolutely right. You're absolutely correct. There was a huge amount of pressure to be perfect. And, I had mentioned initially, and this is true, my parents never actually told me that you have to be perfect. Um,
Mhm.
but in my eyes, both my parents were perfect, my sister was perfect, and so I kind of adopted that as, um, a goal for myself. So but it was a conscious thought at the time that, I need to be the perfect dad, I need to be the perfect husband, I need to be the perfect doctor. Um, I coached several of my kids' sports teams, I need to be the perfect coach. And so I did feel that on a daily basis. And I will say, in terms of wearing a mask at work, yes, I would have to say that 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 is somewhat of what I had to do, um, because, even if you were a very mindful person, which I was not when I was working, back then, but even if you are a very mindful person and you're in touch with your own emotions and vulnerabilities, you know, that's work is not a place to to spout off about that kind of thing. Patients don't wanna hear that from their doctor. Uh,
Right.
patients are made to feel comfortable when they're confident that their doctor is happy and healthy and, essentially a representation of perfection in some ways. But yes, I did have to wear a mask at work and pretend that everything was okay when things weren't okay. And that was ultimately that proved to be kind of a hurdle that I was unable to deal with.
Mhm. That's the uh, kind of part and parcel of this job. Um, anyway, so Dr. Bread, the rea- let's talk about the reality of burnout and substance use in medicine. So, you are not alone in this. Burnout and substance abuse in the medical field, it is real, but it is still so taboo. So, why do you think doctors struggle to admit when they need help? Because one of the points you mentioned, that uh, it's kind of that part of the job that patient will expect a doctor who is good, emotionally stable, confident. What would be your opinion on this?
Yeah, well, right out of the gate, I'll just tell you that over half, close to 60% of all practicing physicians, are struggling with symptoms of burnout at this point. And it's roughly 46% of male physicians and over 60% of female physicians report symptoms of burnout. Um, and the problem with physician burnout, and I'll get to your question in just a second, but one of the problems with physician burnout is that most people don't even know that that's what's going on because they've been dealing with it for so long. Even way back in residency training days, we were encouraged not to complain, not really even to ask questions. essentially to do what you're told, and consider yourself lucky that you're in the position you're in to be trained at whatever institution. So, being emotionally vulnerable is not something that is encouraged in residency training. So by the time you're 5, 6, 7 years into working as a physician, you've probably been burned out for a decade, if not longer. So it's all you know. You consider that the norm. And one of the biggest reasons that physicians avoid asking for help is that they don't want to appear weak. But a very real practical fear that they have is that their state medical board will find out about this psychological issue and prevent them from working. And that's a real fear because it is possible that could happen. You know, the primary responsibility of the state medical boards is safety of the patients. So if they find out that a physician is having severe anxiety or depression, they might tell that physician to stop working, and seek help. And then you're in a position where you're having to prove to the medical board that you're well enough to work. So that's probably the biggest impetus, um, that exists in terms of doctors asking for help.
That's such a good point, and the statistics are really, really staggering, Dr. Brett, because of course there's this expectation that doctors are supposed to be the healers, not the ones who need healing. But if you had to, because you mentioned that sometimes they don't even realize that maybe for more than a decade they are going through burnout. If you had to describe the warning signs, what should a doctor or let's say anyone in a high pressure job look out for?
Sure. Yeah, and I'm glad that you mentioned other high pressure jobs because, burnout is not limited to physicians. And really, it's not limited even to just professions, but we'll talk about the symptoms of burnout in your doctors, teachers, engineers, architects, some
Mhm.
sort of professional career, especially if there's a state board involved, um, for standards. But one of the first warning signs is exactly what happened to me, which was a lack of fulfillment or boredom. Another warning sign is you start to experience negative emotions that you may or may not have experienced previously. So, irritability is a big one. A lack of motivation is one. Anxiety, depression, and impatience, both with yourself and others. You just, it's almost like if you feel like you're almost angry all of the time, um, it's really irritability what I'm describing. But if that's something that someone feels more often than not, then that's a symptom of burnout. Also, if you start to seek distractions, and this is where substance abuse comes in, but it's not limited to addiction to substances. It could be, gambling. It could be some people get addicted to sex and relationships, but unhealthy distractions that you're seeking out. That's another warning sign of burnout. But I would say the top two or the top three are a lack of motivation, a feeling of unfulfillment or boredom, and irritability.
Mm. Thanks for sharing that, doctor. And now I want to play devil's advocate for a second here. Some people say that look, medicine is just hard, or being a fire person, or being in military or something like that, which are really high pressure jobs. It's hard, and burnout is part of the job. So if you can't handle the pressure, maybe you shouldn't be in this role or in this profession. So what would you say to that?
Yes, and I appreciate this question, and I appreciate that you're playing devil's advocate because this is an important discussion. Um, and the point that I'd really like to highlight is that burnout and hard work are sometimes interchanged when they shouldn't be. And really, it's fairly straightforward. The difference between really hard work and being tired and exhausted from hard work, the difference between that and burnout is joy, is happiness. Um, I remember very distinctly in all of medical school and residency in the first several years of private practice for me, I loved it. And I was working very hard. I was
Mhm.
exhausted at the end of the week, but I had such a feeling of fulfillment and joy. I was a happy person. And so
Mhm.
I would say to those people talking no, burnout is not a part of the job. Hard work is part of the job, and the difference between those 2 is happiness.
Mm. That's the perspective shift. That's what it is.
Yes.
Great, great. That's a really great answer, Dr. Brett. And before we wrap up, uh, talking about your coaching, um, so what led you to coaching? You returned to medicine, you got your license back, but then you realized your passion had shifted. So, how did you know coaching was the right path for you?
Yeah, well, this is I'm just gonna say, 10 years ago, I would tell you luck. It was just blind luck.
Okay.
Um, but now I will tell you that it's fate. But
Mm.
as I was back to work, I was working for about 6 months, and I realized that I liked being a doctor, but I didn't love it anymore. And so I was kind of brainstorming on my own and meditating and practicing mindfulness in hopes that an answer will come to me in terms of should I quit being a practicing physician? And if I do, what else should I do? And it just so happens that a friend from residency training um, got in touch with me via Facebook. And we just started talking about the past and training and, reminiscing, so to speak. And she mentioned to me that she was quitting her job as an ENT physician to do coaching full time. And so that was the first time I had ever heard of physician coaching. And that was about a year and a half ago. So that planted the seed in my mind that perhaps I would be a good physician coach. And ultimately, that is the path that I chose and that I'm on. And so the short answer is fate is what led me to coaching.
Beautiful, beautiful. And you know, I think with your answer, people will very um, strongly understand the distinction between fate and luck. So, thank you so much, Dr. Brett, for sharing this. And if our listeners would want to connect with you, learn about your coaching, where's the best place to find you?
Yes, I appreciate that. The best place to find me is my website, which just went live a couple of days ago, but it's theburnoutdoc.com.
Mhm.
www.theburnoutdoc.com.
Great, great. That's really great. And we'll have the links mentioned in the show notes. And Dr. Brett, thank you. Thank you so much for this incredible, heartfelt conversation. And for thank you for sharing your journey from addiction to recovery and to coaching. I think it's not only inspiring, it's important. So I know it's going to resonate with so many people out there, not just in medicine, but in any high pressure career. So thank you so much.
Absolutely. I enjoyed it. Thank you for having me.
So, listeners, if any of you or someone you know is struggling, whether they're a doctor, a lawyer, entrepreneur, or just feeling burnt out in life, they're not feeling that happiness, that sense of fulfillment, uh, just listen to this conversation, share this episode with them, and also do connect with Dr. Brett via his website. We'll have the link in the show notes. And thank you to everyone for tuning into this episode of The Mindful Living. And remember that you are not alone and healing is possible. Until next time, stay mindful, stay kind, and take care of yourself and your loved ones. Thank you.